Good afternoon, everybody. I'm Dr. Vikas from Advanced Health, and today our eminent speaker is Dr. Mrinalini Chaturvedi. Brief about Dr. Mrinalini Chaturvedi is that Dr. Mrinalini Chaturvedi is MD Pathology, MBA, as our one of the esteemed guest speaker for today's sessions. Dr. Chaturvedi is highly accomplished healthcare administrator and a medical advisor at the previous organization. She had an extensive experience in cellular therapies and regenerative medicines. She was instrumental in setting up the lab in the northern India, and she was the first person who has who bring the concept of hybrid cord blood banking in India. And she is the one who has done the guidelines in the DCGI norms. So the guidelines on the cord blood banking has been the created by Dr. Mrinalini Chaturvedi. So it is very difficult to explain in few sentences. I can only tell that she has developed many activities in India as well as in abroad also, and many operations. She is one of the top 10 opinion leader globally, and she has been recognized for that in one of the in Boston University, London. And we are privileged to have her and share her insights on stem cells in orthopedic applications, a topic that bridges a cutting edge science and clinical practice. Please join us in welcoming Dr. Mrinalini Chaturvedi. From my side, Dr. Mrinalini Chaturvedi is one of the best speaker, and she knows the best in this industry and about the stem cells. So she has an extensive experience of more than 35 years, which is more than enough experience. So on behalf of Advanced Cell, I will welcome Dr. Mrinalini Chaturvedi, and I would request her to please start her sessions, which is a good session in orthopedics. Please welcome. Thank you. Thank you.
Thank you, Dr. Vikas, for your kind words. Dr. Vikas has been a very old friend and colleague of mine who shares the same passion in stem cells like me. So it's a privilege to take this talk for as an academic session on behalf of Advanced Cells. And thank you, Advanced Cells, for giving me this opportunity. It is a stem cell research lab which is harnessing the potential of regenerative medicine. Manufactures high quality premium grade stem cells, increasing accessibility for better therapeutics to develop.
Dr. Mrinalini, your mic is mute. Can you please check?
Is it audible now? Is it audible?
It is audible, ma'am.
Should I start? Should I start with the presentation, or should I begin the presentation again? Hello.
Yes, ma'am. Yes, ma'am. You can begin the presentation.
So I thank Dr. Vikas for his kind introduction, a very dear friend and a colleague of mine for years. I am very happy to take this academic session on behalf of Advanced Cells and talk to you about application of stem cells in the field of orthopedics. Advanced Cells harnesses the potential of regenerative medicine by manufacturing premium quality high-grade stem cells, increasing accessibility for better therapeutics, thereby better healthcare, which begets better quality of living. In ISO certified BSL2 laboratory, it produces the stem cells which are thoroughly tested for their quality, viability, purity, and potency, and all the products meet CGMP compliant protocol requirements, with third-party authenticated certification. The applications are many and they are helping advance clinical research in the field of stem cell applications for neurological disorders, bone and orthopedic disorders, spinal cord injury, diabetes, organ damage, chronic obstructive lung disease, diabetes, critical limb ischemia, eye disorders, and infertility issues. As you can see, this is a list of diseases for which we do not have cures today. But the future horizons are beckoning us, and stem cells are becoming the treatment option for such here, till now incurable diseases. More than 2,000 clinical trials are being done using especially mesenchymal stem cells. Among the different sources of stem cells, mesenchymal stem cells are coming in the forefront because they are easily obtained from tissues like bone marrow, the fat or adipose tissue, and umbilical cord. Replacement and reconstruction will soon way to bioregeneration and prevention strategies in healthcare, where we will have new innovative strategies by using stem cells in regenerative medicine applications. And especially in orthopedic diseases, especially in trauma-induced injuries and diseases involving tissue degeneration, bioregeneration is the way forward, and medical science is going to come into its new avatar, where we will see more and more such regenerative medical applications taking center stage. There are various types of stem cells. Each and every tissue in our body harbor stem cells which take care of the day-to-day repair and regenerative mechanisms in our bodies to keep us healthy. We can harvest the stem cells from these various tissues easily. Then there are embryonic stem cells, which are obtained from blastocysts, early embryos, and then today we even have induced pluripotent stem cells, which are genetically modified stem cells by taking as a resource any cell from the body. But mesenchymal stem cells remain the most promising treatment approach, especially in orthopedic applications. They were first isolated from bone marrow and then found to be in various other tissues from which they can be easily isolated, such as umbilical cord, amniotic fluid, bone marrow, placenta, adipose tissue, even joint synovium, synovial fluid, dental pulp, endosteum, and periosteum. Recently identified MSCs are obtained from bursa subacromialis in adults and intrapatellar fat. These cells can be easily obtained from various tissues mentioned earlier. They can be cultivated, that is, cultured in specialized clean rooms, lab settings, and expanded to the required numbers within laboratory in vitro settings. This is just a diagram to show you how these cells are obtained, and finally they are cultured easily cultured, and then they are passaged to increase the numbers to the required numbers in millions that we use today. So how does mesenchymal stem cell act? Well, mesenchymal stem cells have a very great ability. That is, they can migrate to the site of injury or disease, and they are able to also modulate the inflammatory responses which lead to many of the diseases and disorders of degeneration. They exert an anti-inflammatory effect and also an immunomodulatory effect, which is very helpful, especially in autoimmune and degenerative disorders. They have what is known as a paracrine effect. And how this happens is because they secrete growth factors and cytokines such as bone morphogenic proteins, transforming growth factor beta, and vascular endothelial growth factor, which plays a very important role in repair of diseased and damaged tissues and organs. These factors are contained in what today we know as EVs or exosomes. These are vesicles within the cell which are excreted, and they help in the regenerative and repair mechanisms. Genetically modified mesenchymal stem cells are today being researched for long-term release of these helpful growth factors and cytokines. And mesenchymal stem cells are hypoimmunogenic. They evade the host immune mechanism. So they don't see many of the complications which occur due to immune reaction due to transplanted cells and organs. So the functions of mesenchymal stem cells, once again, let us revise. They have differentiation potential. When they reach the site of injury, they are able to differentiate into that particular tissue or cell type where the injury has occurred. We can obtain various types of cells of the bone and connective tissues from mesenchymal stem cells. Because they are immunomodulatory, which means that they can modulate the activity of the immune system, they reduce inflammation, and this property makes them a promising candidate for cell-based therapies, especially in diseases like autoimmune diseases, graft versus host disease, and transplant rejection, which occur because of immune mechanisms. Because they promote tissue repair and regeneration due to release of exosomes containing growth factors and cytokines, they help recruit other cells to the injury site, and these cytokines can promote formation of new blood vessels and that particular tissue where the damage has occurred. And therefore, they are being researched on various disorders for which we do not have cures of as of today. They can differentiate into many of the connective tissues and bone tissues such as osteoblasts, chondrocytes, fibroblasts, tenocytes, vascular smooth muscle cells, endothelial cells, sarcomere muscular cells, as well as neurons. So, especially in orthopedic applications, because they can differentiate into these various different types of cells of the orthopedic tissues, we are using more and more mesenchymal stem cells in regenerative medicine of orthopedic disorders. So where are they finding use in orthopedic conditions? Orthopedic trauma, delayed union or non-union, articular cartilage defects, osteoarthritis, meniscal injuries, bone diseases, osteogenesis imperfecta, tendon and ligament injuries, muscle injury, nerve spinal cord injuries, intervertebral disc problems, and rotator cuff repair. They are extensively being researched, especially in sports injuries and for pain relief. As you can see, this is a diagram to show you where all mesenchymal stem cell based clinical trials are occurring, and a large portion, significant number of trials is towards bone and cartilage diseases, that is in orthopedic applications. So mesenchymal, we know that for last 20 to 30 years, a lot of work is going on in clinical trials where mesenchymal stem cells are being used for various orthopedic conditions. especially in osteoarthritis. And I'm very happy to bring to you today a recently published meta-analysis published in June 2025 in Journal of Molecular Sciences, which has shown, this meta-analysis has shown that finally mesenchymal stem cell therapies are here to stay. All these long years of hard work are showing promises now, because these trials take a long period of time to, for the benefits to be seen objectively. So it is now established that stem cells do facilitate the repair of tissues. An emerging body of literature suggests that cells in question facilitate repair via released extracellular vesicles, which contain cytokines and growth factors. They contain a cargo of molecules which induce endogenous cells to do the actual repair. However, the progress has been challenging and successful translation to patients has been slow. But successful outcomes also are going to depend on development of optimized cells and materials to be implanted, and also creation of the environment in the particular tissue or organ of interest that is conducive to success of stem cell regeneration after implantation. This meta-analysis finally concluded that mesenchymal stem cells can be effectively reduce pain and enhance joint function and quality of life in patients with knee osteoarthritis. And these results support the potential of mesenchymal stem cells as a regenerative and disease modifying therapeutic approach. However, a lot of work has to still be completed in clinical trials. But what came out in this meta-analysis was that there are many factors which influence the outcome of the outcome in such applications. So most important is that stem cells as well as the dose of these stem cells. Secondly, the cellular constituents, that is exosomes, which carry the growth factors, cytokines, and many of the molecules which help in regenerative and repair mechanisms, as well as an optimal environment to receive the interventions and bring the outcome that is desired. So today we not only talk of mesenchymal stem cell, but we also talk of exosomes, which are part and parcel of the regenerative mechanisms of mesenchymal stem cells. There are many advantages which mesenchymal stem cells have. The most important advantage is they can differentiate into various lineages. Secondly, it can be obtained easily from sources like adipose tissue, bone marrow, and perinatal tissue, readily cultured and expanded in GMP grade labs. They can be used autologously, and they can be used also to regenerate large amounts of exosomes. Continued generation of exosomes in vivo after implantation is also a strategy which is being applied. That is, mesenchymal stem cell go into the diseased tissue or organ, and they continue to generate exosomes to bring in the healing mechanisms. And they could be obtained from young adults and stored until needed. The limitations, however, are that numbers decrease with age. So perinatal tissues remain the tissues of choice if we have to obtain mesenchymal stem cell. Extracellular vesicles or exosomes are another area of interest which is developing in regenerative medicine, but it has its own advantage and limitations. Today I'm only focusing on mesenchymal stem cells. So factors which modulate the benefits of stem cell therapy is why we are in a stage of learning curve as far as stem cell applications in diseases is concerned. And today we have identified that there are many factors which ultimately have an influence on how good these therapies will be working in an individual patient. And some of these factors are age. Younger patients tend to have better outcomes. Gender. Males tend to have better outcomes compared to females in some applications like osteoarthritis. Lower bone BMI indices are known to bring in better outcomes. Lesions or defect size also has, an impact on how good the outcome will be, and which stage the osteoarthritis is in also correlates with the outcome. So how do these factors, how do these factors influence the outcome? We know that inflammation is one thing which will have an impact on how well the healing mechanisms are occurring. And mesenchymal stem cells influence inflammation. Sufficient endogenous cells capable of responding to the cellular and EV therapies. Well, what is the condition of the endogenous cells? Therefore, we see younger patients fare better. What comorbidities are present in a patient? If the patient has diabetes or cardiovascular disease or obesity or is in postmenopausal state, then it will influence how good the healing will occur. Other variables are like smoking. Now, how do we administer mesenchymal stem cells into the patient? So there is something called dosage, then frequency, how often we have to give that particular dose, what will be the duration between two doses, and what are the methods in which cell suspension is made to be delivered to the patients, and what are the administrative routes through which these cells are reaching the site of interest. So it can be surface application, intravenous injection, subcutaneous injection, intracardial injection in heart diseases. Sometimes, you directly inject it into the diseased organ or damage, or intra-articularly in osteoarthritis. So we isolated mesenchymal stem cells, expanded mesenchymal stem cells, expanded and activated mesenchymal cells. Today, clinical trials are being conducted where you activate the mesenchymal stem cells in a manner that it is going to heal the tissue or organ of interest. Then implanting the mesenchymal stem cells along with scaffolds is improving the regenerative mechanisms. And co-intervention by use of biomaterials such as PRP, hyaluronic acid, fibrin glue, serum, and even albumin. Then there are surgically, we do microfractures to reach these mesenchymal stem cells and activate them to produce desired EVs or exosomes and kicking the regenerative mechanisms. So delivery mechanisms by injection or implantation, usually we use the dosage being used in clinical trials is 2 million cells per kg body weight. Usually they are combined with things like hyaluronic acid, PRP, etc., which I mentioned earlier. And sometimes implantation of mesenchymals is then done by use of scaffold by seeding them on matrices available in various range of biomaterials such as collagen, fibrin glue, platelet-rich plasma, etc. Now, there are numerous co-interventions which are being used to deliver these mesenchymal stem cells. The most common are microfractures, subchondral drilling, debridement, and PRP use. Less commonly include hyaluronic acid, albumin, serum, osteophyte removal, surgical interventions. How do we measure the effectiveness of the implanted or injected cells? There are specific features of tissue repair which are judged, and secondly, the clinical outcomes. So what are the features of tissue repair that are studied? They are implant stability, defect filling in case there is loss of tissue, integration with border zones in the diseased tissue, cartilage thickness, regeneration of cartilage or that hyaline-like features, especially in osteoarthritis. Clinical outcomes in osteoarthritis are measured by, whether there is pain relief or not, whether quality of life has improved, physical functioning activities like walking, daily activities, sports activities, how well the joint is functioning, and what is the range of motion of the particular joint. So in India, such studies are being done in research centers like Advanced Cells, etc., All India Institute of Medical Sciences, etc. And they have studied the pain score and what is known as WOMAC OA index, where it is concluded that stem cell therapy is a valid alternative treatment, especially for chronic knee osteoarthritis, bringing relief to the patients, especially as far as pain and quality of life is concerned. So mesenchymal stem cells are being also used for orthopedic trauma and bone defects, in repair of meniscus. You can go and read these articles which are cited here to know more about it. Mesenchymal stem cells are being greatly researched in tendon and ligament repair, which bring a lot of discomfort and joint movement disabilities in patients who have tendon and ligament diseases or injuries. And lastly, I will just enumerate that in India, how do we regulate stem cell treatments? Well, stem cell treatments are, need ethics committee approval, which is then, in the form of, if it is done in the form of clinical trial, it will require approval by the CDSCO or Drug Controller General of India. And then there are published guidelines for stem cell research, which dictate how stem cell research is to be conducted. These are available on ICMR and DBT websites. One can go, and how clinical trials have to be done using stem cells. You can, go to the CTSCO site, which provides guidance on how biomedical research using stem cells is to be conducted. And then these clinical trials are usually registered on and listed on the Clinical Trial Registry of India. This is just a comparison that we obtain many mesenchymal stem cells from various resources, but as you can see, the younger the resource, the better, and therefore perinatal tissues remain the tissue of choice. So there is one very important question which is invariably asked, that if you inject stem cells, are they going to be trapped in the lungs, or do they really reach the site where they are intended to be delivered? Well, mesenchymal stem cells have been shown to have a remarkable ability to avoid entrapment in the lungs due to their optimal size, that is 17 to 19 microns, and they are efficient in navigating pulmonary circulation, and thereby they are not trapped by the lungs. So how can one determine if stem cells can help? Well, the stated primary goal is the marked reduction in the level of chronic low-grade inflammation for extended periods of time, and stem cells have a unique intrinsic property that attracts them to inflammation in the body, and they are able to modulate that particular inflammation and bring in anti-inflammatory effects. Studies have shown that mesenchymal stem cells may positively impact especially conditions like inflammatory lung disease. In COVID-19, they found a lot of use, kidney diseases, neuropathy, stroke, apart from orthopedic applications. And what is more important is today we know that stem cell help prevent aging by various mechanisms. And how do they benefit? What is the benefit of a stem cell transplant for aging? It brings in a feeling of vitality and rejuvenation, improves capacity of physical activities, thickening and improved quality of hair is seen, decrease in pain and libido, increase strength and balance and overall mobility, enhance immunity, overall improvement in the quality of life, immune system regulation, decrease inflammatory markers. So, to summarize, we can say that stem cell therapy shall impact orthopedic practice in the future. Mesenchymal stem cells remain the ideal candidate in orthopedic application. Standardization of mesenchymal stem cell product has seen a lot of improvement now, and we are going to see even 3D printing using stem cells in to form or regenerate damaged tissue. Well-designed clinical trials have shown their effectiveness and safety. Time has been a limiting factor, but I brought to you the meta-analysis of 20 years of research, which has shown without any doubt that stem cells are going to be the future of medical science. And treatments using mesenchymal stem cells will become more and more cost-effective and widely available to everyone who needs them. Thank you so much for your patient listening. With that, I close my talk.
Thank you, ma'am. Thank you, Dr. Mini, for highlighting the importance of mesenchymal stem cells in orthopedic indications. And it was a good talk. It was a good lectures, and which detailed about all these applications, the current status, what has to be done, including the future perspective. I thank you from Advanced Cell side to Dr. Mini for such good sessions. Now there are few questions and answers which needs to be addressed or answered from Advanced Cell side. So people have asked few questions. So from Advanced Cell, Dr. Yashvi is there. Dr. Yashvi?
Yes, I'll be.
Hi, Dr. Verma.
Yeah, Dr. Yashvi will be, handling the question and answers, whatever questions has been asked. So I'll just read out the questions and then Dr. Yashvi will be responding it back. So Dr. Mehra has asked, what is the stem cell treatment procedure for orthopedic disorders?
So if we go from the start to the end, so basically the procedure, it begins with the clinical evaluation and diagnostic assessment for the suitability of the patient. And once approved, the stem cells are isolated from the patient's body. And these are usually from the, or else we can also use allogenic setup, which is umbilical cord stem cells using a sterile and GMP compliant technique. And then they are processed in the advanced cells facility and re-administered to the affected area of the patient as per the clinical protocols.
Thank you, Dr. Yashvi. The second question is from Ms. Gurinder. She is asking that who is eligible for stem cell treatment? If I am above 50 years old, can I still take stem cell treatment?
Definitely, definitely. So even from newborns to people in their old age, everyone is eligible for the stem cell treatment. However, provided their overall health, it permits the minor procedures. And the eligibility, however, is also assessed on the basis of the disease stage, joint conditions, and the medical history. However, in general, everyone is eligible for these therapies. And it is absolutely safe as far as the clinical trials are concerned as of now.
Any inclusion exclusion criteria which needs to be taken care at this stage of age?
At the stage of age, that is what I just feel, that provided the overall health of the patient, it permits the minor procedures for their sustainability. So that is the only thing that is necessary majorly, and the one should be free from possible comorbidities.
Thank you. Then the third question is from Ms. Subhadra. She's asking, how is stem cell treatment beneficial for orthopedic disorders as compared to medications or surgery?
Okay, so this is one of the very important questions. So, what stem cells do is they treat the root cause of degeneration rather than targeting the symptoms or providing symptomatic cares, which like painkillers or steroids that offer a temporary kind of relief. So, that is not the case. Stem cells will promote the natural repair mechanisms of the body and stimulate regeneration in the bone tissues, in cartilage, and corrective tissues, which will help to restore the function and delay the disease progression or actually cure the disease from the root.
Okay, okay. Now the next question is from Dr. Solanki. She is asking, how soon can I see the effect of stem cell treatment and how long will I need to take the treatment?
So most of the patients will start to notice a reduction in the pain and an improved symptoms within possibly 4 weeks or up to 8 weeks. And it actually depends on the patient's condition for how long they'll need to take the treatment. Possibly for a progressive improvement, I think they should be going under the therapy for about 3 to 6 months, possibly, depending upon the situation that the patient is in.
Okay, that's a good thing. So so 4 weeks to 8 weeks is the time, and it all depends upon the criticality or the
The
progression of the
criticality.
disease. And
Right.
the next part is how long? Okay, it is already been done. Now the next question is from Akshay. He's asking which stem cells are suitable for orthopedic disorders. Which stem cells do advanced cell offer?
Okay, so advanced cells offer services for both autologous and allogenic stem cells. So as Dr. Mrinalini talked about various kinds of stem cells, as of now, the most safest and would be approved stem cells would be mesenchymal stem cells, which are derived from the adult sources like bone marrow, Watkins jelly, umbilical cord, that is, and adipose tissue. So we offer all these kinds of stem cells for our patients, and depending upon the clinical assessments, we are ready with every kind of stem cell that needs under mesenchymal stem cells.
So the question of Akshay is that he is specific about the stem cells. So the source is either from the umbilical cord tissue derived or from the
Yes,
from the bone marrow,
prefer
which is best for
we
orthopedic
prefer
patients. Which is
for
best.
orthopedic applications. As of now, we would recommend using umbilical cord derived mesenchymal stem cells because they are a naive source of isolation. So they possess a lot of anti-inflammatory factors, which ultimately help in the case of orthopedic.
Thank you, thank you. Thank you, Dr. Yashvi. And the next question is from Mr. Ram Kumar. He's asking, are there any side effects of stem cell treatment?
Not really. There aren't any much known side effects of stem cell treatment because stem cells are free from the MHC class 2 molecules, which are basically responsible for immune reactions. So the body will recognize them as their own, and hence, ideally, there should not be any side effects for that. Moreover, all the procedures are conducted under strict good manufacturing practices, that is GMP and sterile conditions. So we don't have a question of side effects in that case.
And I think all the testing part has been taken care. So there is no issue in the quality of the product which Advanced Cell is making. So
Right.
the next question is from Vishal. He's asking is how are stem cells administered for different types of orthopedic disorders?
So it actually depends upon the site where it is supposed to be transplanted. So usually they are provided in the form of an injection. However, that is something to be determined with the clinician upon the inspection of the patient's needs.
So I guess the IV mode and the injection at the site are
IV
the
and
most
on-site are the most common ones. Yes.
Good. Thank you. Next question is from the Subhadra again. Which stem cells are FDA approved?
At the moment, FDA hasn't approved any stem cells. However, the only approved therapy for stem cells as per FDA is peripheral blood mononuclear cells or HSC transplantation, that is in case of leukemia. But all the other kinds of stem cells and the therapies are currently in trial mode.
I think apart from peripheral blood stem cells, the umbilical cord blood stem cells are also been approved by FDA.
They're currently under trial, but yeah, soon to be approved.
Yeah. Next question is from Akash. What is the success rate of orthopedic disorder treatment with advanced cells stem cells?
So as of now, we're happy to inform that we've seen over 90% patients who have used advanced cells to report significant improvements. While individual outcomes may definitely vary, but at least we can say that above 90% patients are showing really good and significant improvements in that.
Again, next question is from Subhadra. Is stem cell therapy is approved in India?
So again, India as a in terms of regulatories will also follow international guidelines. So yeah, for as I earlier mentioned regarding HSCs, they are approved for leukemia, but Wharton-Jelly stem cells or umbilical cord stem cells are under trial and will soon be approved for that. For autism, however, they are I think they're approved now under proper surveillance.
Okay. Next question is from Akanksha. She is asking is what kind of orthopedic disorders can be treated by advanced cells stem cells?
So
And
by
number number two is what is the cost of stem cell treatment?
Okay, so with respect to the kind of orthopedic disorders that can be treated, I'd say that it can work well with osteoarthritis, that is for knee, hip, shoulder, and others. And then it might also work for rheumatoid arthritis. And then there are traumatic orthopedic disorders. Then we can also go in for tendon and ligament injuries or cartilage defects. So I think those are the ones wherein it should work well. And with respect to the cost of stem cell treatment, I think that will depend upon the dosing regime. So I'd suggest that you get in touch with sales at Advanced Cells that Twinkle has just put in the chat box, and they'll be able to give you a better idea of the cost.
Thank you. And there's one more.
Yeah.
Questions from Nana. She's asking PRP, GFC, or BMAC, which is superior?
I
This
think
is a
all
typical
of
question.
them. Yeah, I think platelet-rich plasma and then GFC and BMAC, all of them are currently, I'd say, comparative to each other. But when we talk about stem cells, so if you say BMAC, so that is bone marrow aspirate concentrate, that will have some stem cells. So I'd still advocate that the formulation that's having stem cells would be presenting better results, just because, as I explained earlier, that will target the root cause of degeneration and rejuvenate the body's natural mechanisms. So I feel that might be better, but it's all in the trial mode as of now.
There is one more question from Dr. Shankar Mahadev. He's asking, is Advanced Cell a hospital or a therapy center for stem cell treatment?
Okay, so no, Advanced Cells is a research lab, and we're a provider of stem cells which are certified and produced under licensed facilities. And the hospitals and therapy centers, they collaborate with us, and hence that is how we work out.
Thank you. I think I would like to say one more thing, which is very important. We have also started the usage of mesenchymal stem cells in graft versus host disease.
Host disease, yeah.
So in practically oncology divisions, we have also entered. The Advanced Cell is entered, and we are getting a good success rate also in these divisions. We are happy to share with you that a few of even the pediatric patients have been free from GVHTs. So they come out and they become like they live like a normal life. So I'm happy to share this using the Advanced Cells stem cells. So there's one more questions, Dr. Yashvi from Naina.
Yeah.
Okay, that is all. That is all.
No,
All together.
that's all.
Thank you very much. And if anybody is having any further questions, you are happy to send it in the messages, and we will be happy to respond back to you. Thank you very much.